believe it would be safe for myself, safe for others as well, and if it's done under the supervision of medical personnel, that would be excellent.
Thousands of needles just like this one, improperly disposed of, is just one sign of the overdose crisis in Manitoba. And for one community member who has seen the effect of the emergency firsthand, he says a supervised consumption site is crucial for Winnipeg. Craig Fontaine used a needle last week to inject drugs. And while it's easy to dispose of needles properly, you first have to know where to go.
You have to find the place, the location. You have to know where you're going, so it's got to be something that you're used to, something you've done before.
Data from Street Connections, the harm reduction branch of the Winnipeg Regional Health Authority, indicated in 2022-2023, 130,728 needles were collected.
If there's needles like laying around, like I wouldn't want any of my children or grandchildren to be walking around. I wouldn't want to see a child be poked by one of these needles.
Through Street Connections, there are several collection programs, including partnerships with 13 community patrol groups, neighborhood cleanup events, collaboration with the city, and needle pickup services for private residents. The city is responsible for needle retrieval on public property, but when it comes to municipal needle drop boxes, the number of 9, according to Fontaine, is far too low.
There's got to be a hell of a lot more.
Fontaine says he feels a supervised consumption site in Manitoba, which government outlined $3.9 million for in its recent budget, will not only help reduce the number of spent needles on the street, but will also save lives in Winnipeg, saying many who use drugs need to be able to access support quickly when ready.
Everybody who's using drugs wants to stop using drugs, but they don't know how.
In Winnipeg, Modjeski, City News.